We are launching a new partnership here on 2 News. It is called Ask the Pharmacist, presented by Cedarville University School of Pharmacy. Jack Pohl is sitting down with a pharmacist from Cedarville University to get advice on health, medications, seasonal concerns, and everyday topics that impact people of all ages.
Thanks, Lauren. We are super excited about this. I'm here with Shannon Yarosz, a PharmD and assistant professor of pharmacy practice with Cedarville University. Thank you so much for joining us this afternoon. We're excited about this new program we're launching today. So let's dive right into this now.
Sure, yeah.
When should someone choose Acetaminophen versus ibuprofen?
Sure. So I get this question a lot. So when someone comes in and they say, hey, should I use, acetaminophen or ibuprofen? Acetaminophen is also known as Tylenol. Ibuprofen is also known as Motrin or Advil. And both can be used for pain or fever. Sometimes ibuprofen can be used a little bit more for swelling. I think of inflammation, muscle pain, those types of things. So if that's something that you're experiencing, I would maybe go towards the ibuprofen. Some little nuances between the two. If someone were to have maybe some liver issues, or if they're a heavy alcohol drinker, I would maybe stay away from acetaminophen, also known as Tylenol. Or if you have stomach ulcers, maybe kidney issues, things of that nature, even high blood pressure, maybe staying away from ibuprofen and choosing the acetaminophen. So those are some differences and some things to bring up to people who ask.
Yeah, well, everyone's aware this year that has been one of the worst flu seasons we've seen, and some people saying 25 years. So how do people tell the difference? They wake up, they don't feel well, between a cold and then the flu?
Sure. So what I like to tell people is the cold, I think of more congestion, runny nose, maybe some coughing, and some minor fatigue. Fatigue is really that tired feeling that you get. And especially the symptoms when they come maybe a little bit slower. So maybe over a few days, that's when I think of a normal cough. The flu usually comes a little bit quicker, very quick onset. You usually get a fever, chills, you're just feeling very achy, and that's what I think of when I think of the flu. So, and that comes on very quickly, like I was saying. So those are two ways to kind of decipher between the two. When to seek medical attention, I usually tell, if it's been a while and you're still experiencing those symptoms, or if you're getting worse, if you have a very high fever, or if you have maybe some chest pain, shortness of breath, if you're getting dehydrated, that's when you would want to go ahead and talk to a medical professional, your healthcare professional. So.
Well, the next question is all about children, and children specifically who are coughing. How does a parent recognize what to give that child? What is the best way to give the child that product, and choosing that product, and which ones to know are safe?
Yeah, that's a great question, because I'm a parent myself. And so what I usually tell everyone is, first, what kind of symptoms is your child experiencing? Because there's a lot of products on the market that have multiple ingredients that do multiple different things. And so we really want to hone in on the symptoms that they're having, and then getting medications that are targeted to that. To know, depending on how old your child is, there are products, depends on the age range and their weight. So you do want to look for products that are marketed towards children, looking at the label that says their age and their weight, and using it that way so it's appropriate.
All right. Well, time flies, doesn't it, when
It
we're
does fly.
having fun here, but we do appreciate you coming by.
Yes,
Shannon Yarosz, PharmD, a assistant professor with the pharmacy practice at Cedarville University.
Yes.
Thanks so much. This was fun. We'll do it again.
Yes, this was fun. Thank you so much.
All right. Now, to ask a question or learn more about the pharmacy profession, visit cedarville.edu/askthepharmacist.